start now.
Okay. Thank you. And then it's not there. Good afternoon once again. Let's look at the second part of our presentation or the second part of our lecture. That is the female pelvis. The female pelvis is divided into two. We have the false pelvis, which is found above the pelvic brim, and it has no obstetric importance. Then we have the true pelvis. The true pelvis is found below the pelvic brim, and it's related to childbirth. Let's look at the true pelvis in details. The true pelvis is composed of the inlet, cavity, and outlet. The image below is showing the pelvic brim, which is in a red color. You can see it's almost round. Then the part which is green is the false pelvis or the greater pelvis. Then the part below, which is yellow, that is the part inside the round red pelvic brim. Inside it or below it is the true pelvis. At times it's known as the lesser pelvis, which is of obstetric significance. The picture below is showing us the inlet, cavity, and outlet of the pelvis. Let's look at the pelvic boundaries. The boundaries of the pelvic brim. These include the sacropromontory, ana of the sacrum, sacroiliac joints, iliopectineal lines, iliopectineal eminences, upper border of the superior pubic rami, pubic tubercles, pubic crests, and upper border of symphysis pubis. Below is an image which is showing us these various points. At times, these various points are known as the landmarks of the true pelvis. You can see right away starting from the sacropromontory, sacroala, sacroiliac joint, iliopectineal line, iliopectineal eminence, the pubic tubercles, the pubic crest, and the symphysis pubis. So altogether, they are around 9 points. Let's look at the diameters of the pelvic brim. We have the anteroposterior diameter, the anteroposterior diameters. We have the anatomical anteroposterior diameter. At times it is known as the true conjugate, and it measures 11 centimeters. The anteroposterior diameter is measured from the tip of the sacropromontory to the lower border of the symphysis pubis. Then we have the obstetric conjugate, which measures 10.5 centimeters. The obstetric conjugate is measured from the tip of the sacropromontory to the most bulging point on the back of the symphysis pubis, which is about 1 centimeter below its upper part. The obstetric conjugate is the shortest antero-posterior diameter. Then we have the diagonal conjugate, which measures 12.5 centimeters. The diagonal conjugate is 1.5 centimeter longer than the true conjugate. And the diagonal conjugate is measured from the tip of sacropromontory to the lower border of the symphysis pubis. Then we have the external conjugate, which is 20 centimeters. The external conjugate is measured from the depression below the lumbar spine to the upper anterior margin of the symphysis pubis. This is usually measured from outside with the help of a pelvimeter, and it does not have any obstetric importance. Below is an image which is showing the which is showing the diameters of the pelvic brim, where they are measured from and to where they end. Let's look at the transverse diameters of the pelvic brim. Transverse diameters of the pelvic brim, when now it comes to the transverse diameters, we shall now talk of the anatomical transverse diameter, which is measuring 13 centimeters, and the anatomical transverse diameter is measured between the two farthest points on the iliopectineal eminences. In fact, it lies 4 centimeters anterior to the sacropromontory and 7 centimeters behind the symphysis pubis. Below is an image which is depicting the transverse diameters of the pelvic brim. You can be able to see where the iliopectineal lines are located. So the transverse diameter the anatomical transverse diameter is the largest diameter in the pelvis. Then we have the obstetric transverse diameter. The obstetric transverse diameter, this bisects the true conjugate and is slightly shorter than the anatomical transverse diameter. Below is an image which is depicting the anatomical transverse diameter, which is measuring 13 centimeters, and it is in a red line. Then we have the obstetric transverse diameter, which is in black line. Let's look at the oblique diameters. We have the right oblique diameter, which is equal to 12 centimeters. The right oblique diameter is measured from the right sacroiliac joint to the left iliopectineal eminence. Then we have the left oblique diameter, which is equal to 12 centimeters. And the left oblique diameter is measured from the sacroiliac joint to the right iliopectineal eminence. Then we have the sacrocotyloid diameters, which are equal to 9 to 9.5 centimeters. Sacrocotyloid diameters are measured from the sacropromontory to the right and the left iliopectineal eminence. So the right diameter ends at the right eminence and vice versa. Below is the diagram, which is showing you the diameters where the sacrocotyloid diameter is located and where it is measured from and where it ends, the right and the left oblique diameters, where they start from and where they end. Then the transverse diameters, where they start from and where they end when measurements are being done, and also the obstetric diameter, which is in obstetric transverse diameter, which is in blue. Then behind there, we have the bispanias diameter, which is in dotted lines, black, and it measures 10.5 centimeters. We are done with the pelvic brim. Let's move on to the second part of the pelvis, which is known as the pelvic cavity. The pelvic cavity is a segment that the pelvic cavity is a segment, and the boundaries of which are the roof of the plane of the pelvic brim. Laterally, we have the obturator internus. We have the pelvic floor muscles. Then anteriorly, we have the shorter symphysis pubis. Posteriorly, we have the longer sacrum. Below is a diagram which is trying to show the pelvic cavity. You can see the pubic symphysis is anterior. The sacrum is posterior. Laterally, you can be able to see the obturator muscles. Let's look at the diameters of the pelvic cavity or the cavity. The cavity is considered to be almost circular in shape, although it is not possible to measure its diameters exactly, but they are considered to be 12 centimeters. The transverse diameter is the widest distance between the iliopectineal lines. Let's look at the outlet. The anatomical outlet is lozenge-shaped. When we talk of a lozenge-shaped, if you have ever suffered from cold one day and you have bought some of those lozenges which they use for sore throat, they are sort of sweet. So the shape is considered like that. That's why they term it lozenge-shaped, or at times they say it is diamond-shaped. If you're fond of playing cards and you know the shape of a diamond, so the pelvic outlet is diamond-shaped. Let's look at its borders. The lower border of symphysis pubis, the pubic arch, istiotuberosities, sacrotuberous and sacrospinous ligaments, and the tip of sacrum. Below is an image showing the boundaries of the pelvic outlet. Let's look at the obstetric outlet. Obstetric outlet and its boundaries. The boundaries of obstetric outlet include the following: the roof of the plane of the least pelvic dimension, the roof of the anatomical outlet, anteriorly the lower border of the symphysis pubis, posteriorly the coccyx, and laterally the istiospines. Let's look at the diameters of the outlet, pelvic outlet. We have the anteroposterior diameters. The anteroposterior diameter is 11 centimeters, and it's measured from the tip of coccyx to the lower border of symphysis pubis. Then we have the obstetric anteroposterior diameter, which is 13 centimeters, and the obstetric anteroposterior diameter is measured from the tip of sacrum to the lower border of the symphysis pubis as the coccyx moves backwards during the second stage of labor. Let's look at the transverse diameters of the pelvic outlet. We have the bituberous diameter, which measures 11 centimeters, and the bituberous diameter is measured between the inner aspects of the ischial tuberosities. Then we have the bispinous diameter, which is measuring 10.5 centimeter, and the bispinous diameter is measured between the tips of the ischial spines. Let's look at the pelvic planes. Pelvic planes, these are imaginary planes. These are imaginary planes that are found in the pelvis. Let's look at the plane of pelvic inlet. The plane of the pelvic inlet passes with the boundaries of the pelvic brim, and it makes an angle of 55 degrees with the horizontal. That is the angle of inclination, or angle of inclination. Then we have the plane of the midcavity. In brackets, at times it's known as the plane of greatest pelvic dimensions. This passes between the middle of the posterior surface of the symphysis pubis and passes between the middle of the posterior surface of the symphysis pubis and the junction between the second and the third sacral vertebrae. Laterally, it passes the center of acetabulum and the upper part of the greater sciatic notch. So the mid cavity is a round plane and measures around 12.5 centimeters. So internal rotation of the head occurs when the biparatal diameter of the fetal skull occupies this widest pelvic plane, while the occiput is on the pelvic floor, that is at the plane of least pelvic dimensions. Let's look at the plane of least pelvic dimensions. This plane passes from the lower border of the symphysis pubis anteriorly to the ischial spines laterally to the tip of sacrum posteriorly. Below is an image which is depicting the plane of the obstetric outlet, or the plane of least pelvic dimensions. As you can see, the plane of obstetric outlet then we have the plane of anatomic outlet. This passes with the boundaries of the anatomical outlet, and it consists of the two triangular planes with the one base, which is the bituberous diameter. If you remember the bituberous diameter that we mentioned, we talked about in the previous slides. Then the anterior sagittal plane. The anterior sagittal plane is the apex at the lower border of the symphysis pubis, or it's an apex at the lower border of the symphysis pubis, whereas the posterior sagittal plane, it's the apex at the tip of the coccyx. So the anterior sagittal diameter measures 6 to 7 centimeters, and it is measured from the lower border of the symphysis pubis to the center of the bituberous diameter. And the posterior sagittal diameter is 7.5 to 10 centimeters, and it is measured from the tip of the sacrum to the center of the bituberous diameter. Let's look at the pelvic axis. The pelvic axis, at times it's known as the anatomical axis or the curve of Curious. This is an imaginary line, that is the curve of Curious, joining the center points of the planes of the inlet, cavity, and outlet. The curve of Curious is C-shaped with the concavity directed forwards. It's of no obstetric importance. Below is the curve of Curious. You can see from the first round dot followed by the second round dot, that is green, upwards. So, what is the importance of this plane? The pelvic axis is an imaginary line that represents the way passed by the head of the fetus during labor or during delivery. It is J-shaped and it passes downwards, backwards, along the axis of the inlet till the isthiospines, where it passes downwards and forwards along the axis of the pelvic inlet. Then the head of the baby is born. Let's look at the classification of pelvises. According to Caldwell-Morley classification of pelvic types, that is in 1933, there are 4 types of female pelvises that are going to be considered. Although majority of the pelvises are a mixture of the types of the 4 pelvises. We have the gynecoid pelvis. 50% of the population of women have the gynecoid pelvis, and the gynecoid pelvis is the normal female type of pelvis. Its inlet is slightly transverse oval. The sacrum is wide with an average concavity and inclination. The side walls are straight with the blunt isthiospines with a subpubic angle of 90 to 100 degrees with sacrosciatic notches that are wide. So this makes the gynecoid pelvis an ample pelvis for delivery of the baby, because it poses least complications or no least complications during the time of delivery. Below is the diagram of the gynecoid pelvis. You can see the anterior and the posterior parts, they are almost round. The second type of pelvis is known as the anthropoid pelvis, and 25% of the women population have anthropoid pelvis. Anthropoid pelvis, at times they call it epi-like pelvis, and the anthropoid pelvis is mostly found in women who are very tall. All the anteroposterior diameters of anthropoid pelvis are long. All transverse diameters are short. The sacrum is long and narrow. The sacrosciatic notches are wide. The subpubic angle is narrow. Therefore, it is also an ample pelvis for childbirth because it also poses the least complications. Below is the image of the anthropoid. Below is the image of the anthropoid pelvis. Third type of pelvis is the android pelvis, which is found in 20% of the population of women, and it is a male type of pelvis. The inlet is triangular or it is heart-shaped with an anterior narrow apex. The side walls are converging, that is female pelvis. It has projecting ischiospines. The sacrosciatic notches are narrow. The subpubic angle is also narrow, that is less than 90 degrees. So you find that the android kind of pelvis is not favorable for childbirth because most of the time the woman may be predisposed to obstructed labor. Below is an image of the android pelvis. You can clearly see the heart-shaped inlet, the anterior part of the pelvis, and also the posterior part of the pelvis, denoted by A and P. Platypeloid pelvis, this is found in 5% of the population of female, and this is a flat type of pelvis. Its anteroposterior diameters are short, all transverse diameters are long, sacrosciatic notch is narrow, subpubic angle is wide. Below is the diagram depicting the platypeloid pelvis. You can look at the inlet. You can see the anterior and the posterior part of the pelvis denoted by A and P. You can see their sizes. Thank you for listening.